take 3 to 6 months to go back and really relearn what it's like to be that first in line is quite a useful exercise. And I think every moment I spent relearning or learning new things was really valuable.
Welcome to At the Heart of It. Welcome to At the Heart of It. I'm Nancy Brown, CEO of the American Heart Association. If you could muster up all the creativity and courage inside of yourself to develop one big thought that would help humanity, what would it be? I'm so excited for you to meet my next guest, who is using his brave idea to save lives.
Changing the future of heart disease. This doctor is going the distance to make some improvement for good. Meet Dr. Calum MacRae. Dr. MacRae is the Vice Chair of Scientific Innovation in the Department of Medicine at Brigham and Women's Hospital. He is also the Associate Professor of Harvard Medical School, Cardiovascular Medicine. Born in Scotland's Isle of Skye, Dr. MacRae initially wanted to be an astrophysicist, but later followed in the footsteps of his father and joined the medical field. Becoming frustrated with how the industry typically studies disease, Dr. MacRae created a vision that landed him $85 million through the American Heart Association to pursue his one brave idea to fight coronary heart disease, making an impact for the better. Today, Dr. MacRae will help inspire you to go after your bold idea.
Hello, Calum.
Hi, Nancy. How are you?
I'm doing great. How are you?
Very well, thank you.
So, Calum, I have a few rapid-fire questions for you. Are you ready to play?
I sure am.
Okay, Calum, question one. What is the last TV show you watched or streamed?
The last TV show I watched or streamed was John Adams, the HBO miniseries about the life of John Adams.
Oh, that sounds wonderful. How about the last great meal you had?
The last great meal I had was a very nice French, Southern French dinner with a close friend of yours and mine, Dan Roden, yesterday evening.
Oh, lovely. Last song you listened to?
Last song I listened to was Knocking on Heaven's Door, Bob Dylan, the original version from the movie Pat Garrett and Billy the Kid, as recently as about an hour and a half ago.
Perfect. What is your superpower?
My superpower is that almost nothing survives a good night's sleep. I can actually waking up the following morning ready to go again, no matter what happened the previous day.
Good for you. And what was your first job?
My first job was actually fishing for lobsters off the west coast of Scotland.
Yum, that sounds wonderful. Well, Calum, you have a big job with major problems to solve. Tell us what motivates you every day.
Well, Nancy, I think I've always been motivated by trying to understand how things work and what happens when they break down and how they break down. I'm also quite a social person, and I interact with patients almost every day. And so I've really tried to combine those two things, try and leave patients and the science that I work on better than how I found it. Maybe don't succeed every day, but I do my best to try and do that consistently and help as many people as I possibly can.
Calum, so many people look to you for answers, your patients, the scientific community, the American Heart Association. But what has been your greatest personal obstacle, and how have you worked to overcome it?
Getting out of your comfort zone, I think, is my biggest obstacle. And I've really enjoyed working on One Brave Idea because it's helped me do that. But I also love working with trainees, with patients, with people who are always pushing you to explore new avenues and to think differently about what it is you've done in the past and where you might have made mistakes or just made even errors that are not necessarily of commission, but of omission. You've forgotten to take into account a particular viewpoint or a particular set of data. And I think that's always a challenge, particularly in science, where you're often building on a body of work that has gone on for maybe 20 or 30 years.
I know so much of, who we are as people is from how we grew up and our parents and our family. And I just love your stories about growing up in Scotland and your family of doctors and scientists and your dad, who was the, only doctor on an island. It's inspiring to me. And I'd love for you to share that story with our listeners. How did your family and growing up in Scotland influence your sense of purpose and your sense of community?
I did grow up, as you mentioned, on a small island off the west coast of Scotland, the Isle of Skye. My father was a primary care physician for really a large part of the island. One of the things I recognized early on, partly, it's incredibly difficult to dissociate wellness and healthcare from community and from family. These are elements of our lives that are sort of embedded in every aspect of our beings. And I've been driven really for the whole of my career, even through my education and beyond, to find ways to engage individuals, families, and communities much more. Patients know much more about their disorders, their diseases, their context than we will ever be able to capture routinely in the medical profession. And we need to find ways to surface those insights and exploit them to accelerate discovery. And I realized how much of even the way that we think about disease is conditioned by our personal relationships with our physicians, with the healthcare system, but also much, much more importantly with our community and families.
You were a very prominent practicing physician in Scotland, and you wanted to come to the United States, and you wanted to learn some new skills. And you sort of put behind you what you had to see the possibility of what could be ahead. Tell us that story.
I think the most difficult thing was really starting from scratch again. I still remember sitting on the edge of my bed on the very first night as an intern again, after having completed all of my training and run a service in the London system. Then one of the things I advocate strongly for is, I think, having senior people take 3 to 6 months to go back and really relearn what it's like to be that first in line is quite a useful exercise. And I think I got so much out of being an intern, resident, and fellow the second time that I would strongly advocate it for everybody who gets the chance to do it.
Yeah. It's something about you I admire so much, Calum, because so many people would see that as stepping backwards, but you saw it as stepping forwards, and you recognized an opportunity, really, to learn new skills, to re-engage in a new way, and that really has helped shape who you are and your philosophy about medicine. And I'd love for you to talk to us a little bit about that philosophy.
Yeah, I think 100% honest, a lot of that came from the early work that I did with rare inherited diseases. I recognized fairly early on that the differences between two families with technically identical diseases caused by different mutations in the same gene, or even the same mutations in the same gene, were actually as profound as the differences between specific diseases, between two completely discrete diseases. That very quickly led me to recognize that the resolution with which we characterize disease is just off by several orders of magnitude. We're just not granular enough. And in many ways, that's a consequence of how medicine has evolved. A lot of the syndromes that we look after, the way we classify the disorders that we manage are really legacy from prior generations. And we don't have this constant drive to reinvent the diseases that we are thinking about, how we configure them. And in fact, it's quite interesting when you listen to patients, the problems that patients complain about with given diseases have even changed over time. What I learned from that was that really recognizing the resolution that patients, families, and communities expect you to understand their disease at is really important. And if we can find ways to capture that information rigorously and begin to understand what are the differences, that will help us, I think, understand what the causes are, and that then gets us from managing outcomes, managing symptoms, or trying to prevent relatively late in the game, being able hopefully to completely eliminate or cure diseases by understanding their fundamental mechanisms. And that's really where I focused in a very deep sense since we were fortunate enough to get the One Brave Idea Award.
one of the founders of the American Heart Association, Dr. Paul Dudley White, had a philosophy when he was dealing with his medical students and trainees. And that philosophy was listen always to what the patient has to say and what they're not saying. And that is more important than any medical test or procedure that you can run. And that is really what you have built your career doing, Calum, is to help understand the unanswered questions on behalf of patients. And your focus with patients has been so significant. You've had the honor and opportunity to work in rare inherited diseases. You are a internationally recognized geneticist, and you always look under different rocks to ask the right questions, just like Paul Dudley White did. Tell us why you do that and why Dr. White might have had that as his philosophy as well.
You need to understand what the problem is that you're trying to solve for the patient before you start to intervene in any way. And I really believe that's something that in some ways we've tended to move away from, partly because we have things that work. So we tend to like to put people in categories where we know there's something that works. And we haven't really asked ourselves carefully enough, is this working for that individual patient? And that's obviously the momentum behind precision medicine. But it's also, I think, at the other end, the momentum behind understanding disease at a very different level of granularity. It's how can you pick up the nuances? I think one of the most concrete examples I can tell you is I've looked after patients with familial hypercholesterolemia for 30 years. And it was only once I started One Brave Idea, I sat down with 5-6-year-olds who were genetically affected with this, but had not yet developed any cardiovascular complications. I asked them, what is it that you notice? And to a man and woman, or a boy and girl, they all complained of the fact that their balance was not as good as the balance of their unaffected siblings or genotypically normal siblings. And it suddenly made me realize this disorder is not just affecting the blood vessels, it's affecting the nerves. And this is a whole area where if you look through the vast majority of the literature, there's just no mention of it. And I think Paul Dudley White got that from day one, that every part of your life impacts your healthcare. He was a really strong advocate for exercise, for prevention, and he was a very powerful force early in the HA in broadening the scope of what it was that heart disease meant and what it was that it meant even to be a cardiologist. So that I think it's one of the reasons that cardiology in general has tended not just to satisfy itself with treating the end outcomes, but is always moving progressively earlier in the disorders to try and understand how to prevent these disorders. And in fact, cardiology is one of the few areas where there are actually preventative therapies that have been remarkably successful. And I think obviously generations of investigators and obviously generations of AHA volunteers have contributed hugely to that endeavor and to the evidence base that we now use to really dramatically reduce the incidence of coronary and other atherosclerotic events.
What are the big questions in cardiovascular disease, and you can throw in a few personal ones if you want to as well, that keep you up at night?
Through the success of lumping everything together, of aggregating individuals in big population-based controlled trials, we may have missed some of the nuance that has really helped fields like cancer get beyond therapy and move actually to actually curing diseases. And I think the same types of approach that have worked really effectively in oncology and infectious disease, I mean, there are now literally definitive cures for some hepatic viruses that were incredibly close to endemic in parts of the world. I think we need, in order to accomplish that in cardiovascular disease, to split apart again the syndromes that we aggregated many years ago for the purposes of those original clinical trials. And that's really what I've spent a lot of time working on, is really trying to not to satisfy our own goals, but to satisfy the goals of the patients who, if you talk to them, they want to know why there isn't a strategy to surveil for deviations from wellness. There isn't a plan for understanding what it is that maintains health, why there isn't a scientific endeavor to try and recorrect those imbalances as soon as they occur. We tend to wait until things emerge that fit our concepts of disease, rather than redefining disease more granularly and in a way that's more aligned with our patients' long-term visions for their own lives. So it's how do we accomplish that? Well, a lot of it is really trying to break down the existing disorders into syndromes that are much more granular and precise.
You know, you and I have spent so much time talking over this past year and a half during the pandemic, Calum, about the fact that science and research are now more relevant to the average person. People understand the power of science and the urgency of science. So how do we take that sense of urgency that people have and help people participate in research? And if more people participated in research, how would that help public health?
I think in many ways, if you look at other parts of our lives, almost everything we do is a transaction that adds information content to a system that then allows that system to improve. And I think one of the biggest disparities between medicine and other fields is that the research and clinical care are really in separate spheres. Now, there are good reasons for that. Conflict of interest was obviously always something that people were focused on. But nowadays, with the ability to make data gathering and data sourcing and data analysis much more transparent and still have it be secure, I think there's really an opportunity for everybody to participate in the research that's necessary to continuously optimize wellness and healthcare. An obvious example is the COVID pandemic. You know, we're now in a situation where probably some 500 million individuals have been infected with a virus that lasts for 3 or 4 weeks. And yet the body of evidence, even including all of the randomized trials for vaccines, is still probably in the order of only 100,000 people. Why is it that there's this massive disparity for a pandemic that we had about 100 years of warning that it was coming? And I think some of it is the fact that we've just failed to engage patients in understanding, A, how big the questions are that we still need to answer, and B, how important they are in answering those questions. And one of the real successes, I think, of the pandemic is the fact that people are beginning to recognize that communicating information and the uncertainty around information is a really important task for biomedicine and particularly for researchers. And I'm hopeful that will move the needle. But I do think we also need much more direct ways of offering to patients the opportunity to participate in biomedical research so that we can understand how diseases evolve over time instead of just looking at them cross-sectionally. If we were collecting information in large population-based studies or even in just daily life, empowering people to record and collect the information that they might need.
Yeah, it's so important. I often think to myself that people don't realize even a little bit of their information by participating in science could save the life of the person standing next to them, laying in the hospital bed, you know, in the room that they're sharing. It's so important. And I do think this is a moment, and it's a moment for us to use the trust that we have with the public to inspire people to participate in research. And speaking of inspiring, Calum, you know, when we selected you to lead One Brave Idea, our $85 million research enterprise. That was a moment, and it was a moment of inspiration, and it was a moment where we, the American Heart Association, Verily, and AstraZeneca, saw in you. Tell us what we should know about the work that you're doing and the things that will make life better for people because of this award to you and your incredible team.
I think we've touched briefly on the three broad themes that we've been working on over the last few years. One of them is really finding methods to reach out to patients and include them in our research. We've done that really at every level, from middle schools through to direct-to-consumer approaches in a variety of different settings. And we're refining that constantly as we go through the research period in One Brave Idea. The other two areas that we have been really focused on are empowering patients to take charge of their own care. And one of the things that we found was that in many instances, families who had risk were not really able to communicate that risk effectively to their providers, that there was a difficulty, partly because people are in different health systems, they're in different insurance plans, they're at different age groups. How did we begin to build a set of tools that would empower an individual had a disorder to communicate the risk of that disorder to his relatives, to other family members, and have them then take that information in a way that could be used by their own providers locally without us having to undertake a massive research effort, actually making it part of what just was the natural occurrence after a diagnosis like this. The evidence base is very strong for that. And if we could implement that technology, i.e. genetics, in a rigorous way, the actual tools for genetics have been stable for about a decade, yet only about 5% of those with genetic risk for heart disease actually ever get tested for it. If we could find a way to empower patients to change that risk equation, we could then do that iteratively for new technologies as they emerged. And so we spent a lot of time on that. And then the area that we spent the bulk of our effort on is really trying to understand, take a disease like cardiometabolic disease or atherosclerosis or just something really specific like coronary artery disease, and break it into its constituent parts. And we've done that using a combination of technologies that we've deliberately focused on to be low cost and very readily available in the community. But we've added in a series of perturbations, of stress tests for your cells, stress tests for your body processes, and then very simple ways of pushing the system to try and understand it a little bit better, but then using artificial intelligence to collect that information and then use that information to split apart the diseases into distinctive subtypes of disease with distinctive long-term consequences. Is what we've done is be able to make it so that you can very quickly take disorders that previously people thought were a single entity and split them into constituent parts. We found new pathways for blood clotting, new pathways for kidney disease and the confluence of kidney disease, diabetes, and heart disease. And those are all being added to every day. And we think it's a generalizable strategy that can be used in other diseases quite rigorously. And we're excited that it may also accelerate the timeline from discovery to an intervention.
You know, we're so proud of the fact that your work will truly help us humanize drug development, and it will help us deepen in a way using novel technology that we're able to gather information that really matters in understanding disease progression and disease management, all with the deep genetic background that you and your team have. It's exciting, it's bold, and we know it will change the world, and so we're so proud of what you have done. So let me switch to a couple of personal questions, Calum. What is the best personal advice you have been given? And I'm going to press you not to make it about your science or your clinical care, but just personally, what's the best advice you've been given?
The best personal advice I was ever given was actually from a scientist, but it was about the whole of my life. It was my pharmacology tutor in medical school who said, you need to define what you do in life by the questions that you ask. And it certainly applies in science, but I think it's also a very good rule to live by in your regular life, in clinic, in almost any environment. How do you interact with other people? How do you listen to them? How do you recognize what they're bringing? How do you ask them about themselves? It's a great way of starting any conversation. It's a great way of starting any day at work, is think about the questions you're going to ask that day and how you might answer them.
Wonderful advice. And speaking of advice, what advice would you give parents to foster a greater interest in their children of careers in STEM?
The sense that everything is didactic is really something that you have to overcome. I think this applies in everything from poetry through to physics, that we should always be re-educating ourselves across the entire spectrum of what we do. It's the only way that we can pierce the shibboleths in our knowledge and move in a new direction or advance the field in any field, is by pushing the boundaries and exploring directly. And I think that's something we tend not to do. There's a very didactic and multiple choice questionnaire type approach that really took over education for many years. We see it even in medical schools. I think we need to move beyond that to a much more exploratory and evaluative approach to learning.
You're so right. You know, students in STEM have a unique ability to really see the world, understand, and problem solve. And those are life skills, no matter what you do with the rest of your life. So really good advice, Calum. Last question. If you could give us one thing that we as individuals could do to improve our heart health, what would it be?
I would say walk outdoors in daylight for at least 20 minutes every day, ideally with someone that you want to talk with and without your phone. Leave it behind and catch the wind. That's what I would recommend.
I love it. Dr. Calum MacRae, thank you for your incredible vision, your passion, your incredible science, and for being our guest today. It's been wonderful to catch up with you.
Thank you, Nancy. Thank you for having me. Great to talk to you.
Thank you. I so enjoyed talking to Dr. Calum MacRae. You know, here is an incredible scientist and a world-renowned geneticist, but the things I learned from listening to Calum today were the importance of going after the things you want for yourself in life. You know, here he was, a remarkably prominent, well-established physician in London, but he wanted to become a geneticist, so he gave up everything he had to come to the United States and basically start over again, to go through internship and fellowship and to learn something that now is so core to what he does and who he is as a person, and that's genetics. And that helped him get the One Brave Idea Research Award. And the other thing about Calum that I think is really unique and that I learned from listening to him today is the power of asking great questions and listening for people's answers before you make assumptions. And whether that's in medicine or in life, what a valuable skill. He talked about keeping your hands in your pocket until you know the right questions to ask. I thought those were remarkable pieces of wisdom that can help us all every single day. So I'd really like to know what you took away from our conversation today. Please subscribe, comment, and share. I'm Nancy Brown. Thank you for joining in.
Next, on At the Heart of It with Nancy Brown, self-care is more than just a new trend. It's a way to live a better life.
When employees take care of themselves, they are more productive, more creative, more empathetic, more inclusive.
Hear how CEO and sleep expert Ariana Huffington can help you live a more balanced life. Next on At the Heart of It.